faster return to normal activity. Next slide, please. What if the cancer has spread? Let's get back to the cancer discussion. So now we talk about what we do. If the cancer has gone to the lymph nodes, if it's gone, then you don't want to take out you don't want to do surgery for those patients right away. And I'll be the first one to tell them that, I could do an operation for you, but it's not going to help you. It's just going to give you morbidity. It's going to cause you harm. And so you try our other options. There's chemotherapy and radiation. Now, chemotherapy, the way that works is it's basically a drug that kills cells that like to divide. So cells in your body that like to divide are cancer cells, the lining of your stomach, lining of your intestines. Those cells are frequently sort of cleaning themselves and replenishing themselves. So people who get chemo, they feel ill. They get a lot of effects of nausea and problems with their GI. Hair follicle cells, hair cells like to grow. So sometimes people with chemotherapy lose their hair, depending upon the type of chemotherapy you get. So it goes into your bloodstream and goes everywhere, and it kills all the cells that are divided. The oldest forms of chemotherapy that are out there, when they first came out, they would kill the cancers very well. They would also kill a lot of the patients. So in the process of evolving our ability to cure cancer or to help cancer, we've come up with certain drugs that are a little bit more targeted, a little bit nicer, a little bit better, that kill the cancers and don't cause a lot of side effects. And right now, as it stands, we're pretty good. We've got some pretty good drugs that people don't get so sick from. Chemotherapy also kills immune system cells. Your immune system cells, your white blood cells, the normal cells that if you get an infection anywhere, the things that divide and cause inflammation and your ability to fight infections, those cells go away too, because they like to divide. Chemotherapy will kill them. And so people are more prone to infections during chemotherapy. So it's not a great thing to have to undergo, but it kills the cancer cells pretty quickly, and it kills all the cancer cells. It tries to kill, or attempts to kill, all the cancer cells in the body that are not in the primary tumor. Meaning that if the lung cancer has spread to the lymph nodes, it's probably has little microscopic cells floating around your bloodstream trying to land somewhere and cause a metastasis, which is a spread. So basically, what the chemotherapy does is it kills those, because theoretically those areas in the body where those little microscopic cells are floating around, they'll just die, because they're not big enough yet. So they're small, and they get affected very easily by chemotherapy. And it kills the cancers in the lymph nodes, and